Assalamualaikum. I'm Dr. Tahira. Welcome to the program Health is Wealth on PTV World. Winter is here and we have temperatures dropping below freezing now. And as winter comes, pain starts happening. And when the pain is more and more, we need to get rid of it. That is why today we are present with Neurosurgeon Dr. Asad at HM Diagnostics to deal with this pain. Welcome to another episode of Health is Wealth on PTV World. Winter is here, the temperatures are dropping, everybody is cold and jittery, but with a lot of cold comes a lot of pain. And why is pain so important? Because nobody in this universe can actually live on with pain. Pain is a very, disturbing condition and everybody wants to get out of it as soon as possible. That is why today we are here at HM Diagnostics with Dr. Asad Javed, who is a neurosurgeon and a pain specialist. And he's going to tell us all we need to know about how we need to get rid of this pain during this winter time. Thank you so much for joining us, Dr. Asad. How are you doing?
Thank you. Alhamdulillah.
So, as soon as winter comes and the temperature drops, everybody out there starts getting pains. They get joint pains, knee pain, ankle pain, back pain. So, what is the reason for this great pain?
The pain and the weather, that's, I think, correlated, and patients feels more pain while the weather changes and it becomes cold. It's because when there's temperature drops, the nerve conduction that's also increases, that causes pain. So majority of the patient who comes to us clinics in these days, they have back pains and neck aches, and the pain aggravates when the weather temperatures go down.
And do you think it is also because during winters we just get into our blankets, we don't move at all, and with a lot of no mobility also the pain starts
you can
increasing?
say like that because due to the cold we can't get out and take our daily exercise or whatever.
So what are the primary reasons for, let us start with neck pain first, then we will go down gradually. What are the reasons for neck pain neurologically?
Okay, nowadays looking at our lifestyle, we are usually busy in doing using our cell phones. That's the main cause of having that neck pain, and nowadays they have added another disease due to this over usage of mobile phone, text neck.
Okay.
Basically, when you use and you bend your neck, your weight increases on your spine and it causes disc degeneration more earlier than the usual age.
So when we talk about neck pain and then we come back to back pain, we speak about many conditions that can possibly lead to back pain. So what are the different causes of back pain, and then we will go towards their management later?
Well, if we categorize different causes which leads to back pain, on the top that is degeneration. And the degeneration process is not that it comes in your genes. You actually accelerate it by not doing exercise, by eating a lot of junk food, and by not taking care of your postures. So these are the main causes which leads to the back pain. And then later on, when the discs shift from its sides, then it causes compression over the nerve roots and the pain goes down in your limbs. And that's a very disabling pain. You cannot move around, you cannot stand, even you cannot walk around. So majority of the patients who comes to us are obese and they're not doing their daily exercise. Yes, that's the main
So
cause.
when we speak about back pain, or for example hip pain or knee pain, any pain for that matter, there are many ways to go about it. Some are conservative approach, and then there is the surgical approach. You being a neurosurgeon, it is very good, you know exactly where the problem lies.
Exactly.
So what are the different methods of coping with pain? First we will go to the conservative methods and then your surgical options.
Well, thanks to being a neurosurgeon, and in market you see there are multiple people who are saying that we treat pain, even they don't know the exact pathology of the pain.
They don't know the location, they don't know what is the reason.
And being a neurosurgeon, I have seen the structures, I have gone through those things that were causing pain. So if I talk about how we will manage pain, it depends all upon the pathology, that what is causing the pain. We start with conservative treatment, which include different kinds of medications along with physical therapy. And nowadays we have other techniques in the form of stem cells therapies and PRPs and some kind of steroid injections. People think that the steroid injections are not good, but in my opinion, if you are putting in a right space and a right amount of dose, then it's very beneficial by taking, rather than taking the medication orally. It's directly goes to the point where it hurts.
But
So
you
it
know, what you're
gives
saying
you
is so
quick
right.
relief.
It is very important that the person who is actually administering the injection knows the location and knows the
That's exactly.
pathology behind it.
Exactly.
The reason we are saying this is a lot of quacks out there are, you know, claiming to run pain clinics, and they start intervening in these joints without sterilization, without proper knowledge. Can you talk about the harmful effects of injecting in a wrong place?
Well, there are very harmful and lethal effects if you put the drug in a wrong place, specifically in the spine. People nowadays, they are saying that we are treating the pain with these injections, but they don't know how to put that drug in a very specific area.
Right.
So if you put that drug in a wrong place, especially inside the thecal sac, where the body, where the brain CSF is there, it will lead to directly meningitis, and the patient can even have death due to that injection.
So it's not
And
only
the paralysis,
fatal,
yeah,
but
exactly.
you're talking about paralysis and
Yeah,
disability as a
exactly,
reason.
exactly.
Okay, what about these people, you know, we call them massage therapists or
Chiropractors.
masseurs or chiropractors who are, you know, trying to align the spine. Are they the right people to trust or no?
I mean, if I talk about chiropractors, if they are well trained and they know how to manipulate a joint, then
The
that's
traction,
good. Yes,
yeah.
exactly. But majority in our country, in our setup, the people they start doing things. They are experimenting on different patients, and they cause more harm than benefit.
But if it is done, if a chiropractor and a physiotherapist are under the supervision of a neurologist like yourself or a neurosurgeon, then don't you think they will get a whole comprehensive package where they can get all these services under one roof like
Exactly.
yours?
We are offering these special, under one roof, these services here in our HM Diagnostics. Being a neurosurgeon, I'm taking care of all those facilities. I have a physiotherapist, and I have other neurologists with the help of which we are.
So how important is physiotherapy? How does physiotherapy help in rehabilitation? We are talking about regenerative medicine now because you're combining not just surgery but diagnosis with rehabilitation.
Exactly.
So how important is physiotherapy? How many sessions are required? And what kind of program do you design for them?
Well, if I say physiotherapy is very beneficial in treating especially the back pains and the neck pains, because whenever there is pain due to some pathology, the muscles go in spasm, which cause more pain. So for that, we have to have a good physiotherapist and good manipulator of those muscles. For that, we have different modalities how to get the muscles relaxed. We have different modalities like ultrasound, we have dry needling, we have PRPs, we have stem cell therapies, which can decrease the pain.
Right.
And I definitely emphasize on having a physiotherapist at different medical facilities.
For example, a physiotherapist uses something called a TENS machine, and they attach those probes to us. And then they also, there are a lot of people who are practicing this acupuncture and different pressure points. Do these things also help in, you know, causing neovascularization of that area, bringing growth factors to that area, repairing that area? And then there are people claiming to have some kind of cold lasers in the market. Are they placebos or do they work as well?
Well, there is a bit of a placebo effect as well, and a majority of these modalities, they cause inflammation over the site where there is pathology. So inflammation is a natural process which gets new blood vessels, new cells, which causes regeneration there. So TENS therapy as far as and other therapies which are
with needles
causing,
and
yeah,
everything.
exactly, dry
so
needling.
they induce an injury to
Exactly.
cause more repair.
Exactly. They cause injury in the healthy area, which gets a lot of other blood vessels and nutrients, and then they repair that injured area as well as the area which is not working properly.
But the underlying line over here is you should know how to give
Exactly.
that controlled injury.
Exactly.
Right?
You have to know that what thing is causing the pain, because in the spine specifically there are multiple things which can give you the back pain.
Right.
The pain can be due to the disc problem, can be due to the joints problem, can be due to the over thickening of the ligamentum flavum, can be due to the different vertebral body fractures. So you have to have the knowledge, basic knowledge, anatomy of the spine to treat these painful conditions.
So when somebody
properly.
comes up to you, what are the diagnostics that you tell them or advise them to actually first judge where is their pain coming from? What are the different diagnostics?
Well, every pain has different presentations. Every pathology presents with different, they all have the pain, but the pain characteristic is different from each other. So by listening to the patient and then examining him or her, we can decide that what is causing the pain. And the next comes the diagnosis. For that we have gold standard test that is called an MRI. Okay. So we do MRI and we see where is the actual problem. and then we devise a plan to treat the pain which is causing
So an
disabling
MRI
condition.
under one roof is fine. We also have EMG NCS. What exactly does an EMG NCS tell you?
Well, a lot of conditions which have back pain are not due to the spinal issues. That can be due to the peripheral neuropathies, the nerves which go down in the limbs.
Right.
They have their own diseases, and the muscles which are attached to the bones which causes movement, they have their own disease. So at times you don't have the problem in your spine, but rather in the peripheral nerves or in the muscles. So these modalities, they actually help us in diagnosis, making a diagnosis that whether the patient is suffering from a peripheral disease or the pain is coming from the center.
Okay. When we speak about all these problems, you said that the causes can either be neurogenic or they can be orthopedic as well. That's why
Exactly.
you have an orthopedic surgeon present in the facility,
Yeah.
and you have a neurologist and you have a neurosurgeon. Now, if the problem is surgical, for example, there is some outgrowth, bony outgrowth, or there is some kind of compression or some kind of bulge or something has, twisted or turned in another direction, kyphosis, then what are the surgical options available?
Well, being a neurosurgeon and being a surgeon, I'm very happy to operate upon. And there are multiple minimally invasive spine surgeries nowadays. And alhamdulillah, I'm doing those surgeries in which we are actually removing the disc material with a very small incision. The patient can walk around after very
So
few
you're
hours
relieving
after
the compression. This is called
Yeah.
decompression?
Yeah, that is called decompression. If we talk about the surgical procedure, there are a lot of minimally invasive procedure in the market and endoscopic procedures as well. So alhamdulillah, I'm doing those surgeries, and although surgery have some complications, previously there were more complications as compared to nowadays, because things are very refined. We have newer technologies. We can see the things under vision. We go and we remove the disc material. We inject the steroid injection inside that inflamed joints. And we also do the regenerative medication therapy like stem cells and PRPs as well.
What about this hyaluronic acid or silicone injections? Do they
Yeah.
work as well?
Yeah.
Do they perform? Do they give that cushioning effect that is required between the joints?
Normally, in a joint fluid, there is a initial component that is called hyaluronic acid.
Okay.
That's natural constituent of the joint fluid.
Okay.
So whenever there is joint disease, the fluid got disturbed, destructed. So we have to replace that with injections. And of course, it has many beneficial effects, and especially in the knee joint problems. Although we are not using that in the spine, but yeah, of course,
In the
knee
joints,
yes,
in the
it's
other.
good. Yeah.
So when we talk about neurosurgery, and you're performing different, there are different things for sciatica and for carpal tunnel syndrome as well,
Yeah.
because it is all about nerve compression. So do you operate in the wrist and, for example, in the hip joint or wherever the sciatica is arising from? Where does sciatica arise from actually?
Basically, sciatica is due to the compression of the sciatic nerve. And sciatic nerve starts in the lumbar area and goes down to the sacral area. So whenever there is disc prolapse or compression over the nerve roots, which is a part of the sciatic nerve, it causes the pain which goes down the limb. So that is called, in simple words, sciatica.
So is there
we
a surgery for it?
of
Surgical
course,
option?
of course, it depends upon the stages.
Severity.
Yeah, severity of the disease, stage of the herniation, and apart from that, any other associated problem which is causing the sciatica.
So if there is a cause of pain that cannot be fixed by medicines, but yet people keep taking anti-inflammatory and analgesics their whole life, can you explain to them that it is very important for you to actually fix it surgically rather than just destroy your kidneys and liver with those medications?
Well, by your program, I will definitely tell my viewers that if they are suffering from some chronic pain which is not getting relieved by medication and physiotherapy, they are a good candidate for surgery. And surgery, alhamdulillah, is safe and has a good results. They can even check on the Google. Majority of the patients, they come to us and they have more information than us because they have Googled all the conditions. But yet they are not looking at the proper information. If you are a scholar, then go to Google Scholar, and there you can see the proper information. And alhamdulillah, results are very good and very promising. And if you are having
and there are no
this
side
thing,
effects, and the benefits are more.
of course,
than the risk.
when we cut something, the patient feels pain at that site, which is get relieved with, again, the stretching and physiotherapy and massage creams. But you have to be very committed for that rehabilitation.
All right. What about foot drop? A lot of people lately are complaining of, what is the reason for foot drop?
Well, if you don't treat your back pain, take it seriously, you get it done. If you done surgery lately, then there are chances that you will get the foot drop. It's because the nerve which is supplying to hold the foot up is being either destroyed before surgery or after within surgery. If you have the problem for the last few hours, months or years, then the nerve is very thin, and when you are doing surgery, even little retraction of the nerve root can give you the foot drop.
So there is a treatment for it?
Yeah, there is a treatment because it's basically occurs due to the disturbance in the electrical flow in the nerves.
Okay.
So whenever the patient gets a foot drop, we have to assure him first of all that it will get better. Along with this, we have other ankle foot arthroses and physiotherapy along with 10 machines.
What is neuropathy? You know, people complain of diabetic neuropathy and other neuropathies, after which they stop, first they lose sensation in their feet or their hands, and then they start feeling pins, needles, numbness. How do you cure this neuropathy, and what is the role of B12 in this?
Okay, first of all, neuropathy is a disease in which the covering of the nerve, which is carrying the currents from the brain to the different areas of the body, they get disturbed. So the covering is made by the vitamin B12, and there are different diseases which causes destruction of that covering.
Okay.
So that leads to the abnormal sensation in your hand or in your feet.
And losing sensation also?
Yeah, you can have abnormal sensation along with loss of sensation can occur.
And how do you recover that?
Majority of the patient have to have that you have to control the underlying problem. If you are diabetic or you are having other problem, then you have to take care of your diabetes.
And if it is due to some kind of compression or degenerative disease?
If that is due to degeneration, either it's disc disease or compression in your wrist, then you have to remove the compression, and it will decrease the, it will recover the nerve.
But if it is already damaged, can you bring it back?
Well, there are regenerative medication, as
we already spoke
told
of
you.
regeneration.
Stem cells are the
so a lot of people are actually fooling people in the name of stem cells.
Yeah.
So could you please tell people that stem cells is actually what you are going to isolate from their own blood, put it in a stem cell separator.
First of all, stem cells are not the common cells. You have either to take your blood and other samples from your body, and there is a machine in which we have to put that sample, and that will give us concentrated form of your cells, and majority of those cells have the capacity to change into different cells lines, and they can then regenerate into different things.
And please tell them that there are people who are selling some kind of radiations and some kind of things. They're saying, oh, we are doing it with your DNA and all of that. So please tell people not to because they're in pain, so they will apply all sorts of oils and everything. So can you guide them or not go for that?
Yeah, there in the market, there are a lot of people who are claiming that we have newer technologies and they have stem cells, whatever they call it, but they are doing in their, clinic setup, they don't have those facilities. I will advise people to, of course, check before doing any procedure on them. They have to look into the clinic setting, and they have to look the qualification of the care provider who is doing this. If he is a qualified person and he is claiming that, of course, he has the technology.
What is lumbar puncture exactly, and should it be very carefully done, because people often complain of getting a lumbar puncture test done and then they have back pain after that?
Well, majority of the females who have in the childbearing age, they have a C-section, then
they have epidural, no?
Yeah, epidural or spinal. So in that case, they develop backache, and that occurs due to the puncture of the dura, which is the covering of the brain and the spine. And CSF is within those layers. So whenever there is lumbar puncture, there is dural puncture. At times the CSF start leaking from that puncture, and that leads to headache and the backache. So of course,
how to avoid that?
If get your lumbar puncture by a qualified person, of course with a smaller needle as compared to the larger one. But there are brain diseases in which we have to do a lumbar puncture with a bigger needle, because we want to decrease the CSF pressure. So if a person is getting having pain due to...
So you do advise to pregnant women who are opting for delivery that they should avoid spinal anesthesia?
There are different techniques, pencil tip technique. There is very smaller gauge needles which can be used for the epidurals, so they cause less post-operative pain as compared to the bigger size.
If we speak about tumors, what tumors are evident along the spine, along the brain and spinal cord tumors? How do these tumors present?
Well, majority of the tumors after 40 years and 50 years, they present with headache, vomiting, loss of any movement in your limbs, along with the episodes of loss of consciousness, which we call fits. So a majority of the patient, if they are having any problem in their brain, they present with these symptoms. Although there are areas of the brain which we call silent areas, in which brain tumors start growing and they become very big before they present with any symptoms. So frontal lobes, which are actually the area which is lying in your forehead, that is called the silent areas, where there are less, although vital function, but whenever there is some tumors, they grow in a larger size before the patient presents to a doctor.
And how early on can a tumor be detected? What are the tests for a tumor to be detected? And does it help? Does it help save the life of the patient?
Of course, if a thing is detected early and is treated early, then the outcome is definitely better. However, if someone is having any headache, it's more than 6 months or 3 months, then it's better to go for an MRI brain to see.
MRI or CT scan, which one is more better?
For trauma, in case of accident emergency, when we have to get the things quickly, then CT scan is better. In case you are having headache, then it's better to go for an MRI.
And we spoke about these tumor surgeries. Are they also less invasive, because previously people used to break open the skull and see all these things? So is it any better now?
Yeah, of course, everything is shifting towards minimally invasive spine and brain surgeries. Of course, in case of brain surgeries, we have smaller openings, you can have keyhole openings, smaller opening. With the help of camera, we can remove the tumors.
And these tumors are present, along the spine as well. Do you see a lot of spinal tumors?
Brain tumors are more common as compared to spine tumors. However, the tumors can occur anywhere inside the brain and spine. And it also depends on your age. In pediatric age group, we have brain tumors inside the posterior brain, while in case of adult age, it's more in the upper region.
Okay. What are neurofibromas or neurofibromatosis? What exactly
neurofibromatosis
is
is a congenital condition in which you have seen different patients. We have many skin tags on them and a lot of different coarse facial features. Neurofibromas are basically the benign tumors which arise from the nerve roots. Nerve roots are the things which carry your sensation from brain.
And it's not dangerous? You don't need to do anything about it?
Again, it depends upon the location of the tumor. If it's occurring in your hand, it's not dangerous, but it's occurring when your brain, especially in the posterior fossa, it's very dangerous. Especially in the spine, the cervical spine, they are dangerous.
What are the congenital conditions that children are born with neurologically that need to be operated? For example, meningocele and hydrocele.
Unfortunately, if we talk about these conditions, they are very common here as compared to the West. That's because we don't go to the doctors in our pregnant women. They just keep their pregnancy until the baby is going to born. They are at home. They don't take medication, especially the folic acid, which is the culprit in having these problems. Majority of the patient, they present to us with the problem that they are having any sort of swelling in their back of the head or on their lumbar area. So along with this, the baby also have a problem in their CSF drainage. So they have big head. I have previously, in the last week, I have operated 3-4 kids with a very big size. And I asked the parents why they were not going to operate when the head was smaller and it was very suitable to get operated. So they again, first of all, they don't go to the doctor during their pregnancy, and after the birth, they even go to the doctor again. And they go after periods and thumbs and they say that it will get corrected, but unfortunately, the things don't go the way they wish. And these kids are in very terrible conditions. They have head size double, triple than the normal one. So, and they are very emaciated, and I feel very pity.
So for neural health, you suggested exercise and you suggested a good posture. Yeah. What is the ideal diet along with folic acid that you would suggest to everybody watching for good nerves, brain, spine, and your general health?
Well, exercise is the best medication. It gives you everything which you are taking. But along with that, of course, taking different kinds of multivitamins. If you are not taking a good food, if you are taking healthy food, balanced diet, then of course you are getting all the nutrients you need. But if you are not getting those, then multivitamins in the form of vitamin B complex, that is very healthy for the brain function.
So Dr. Asad, we have a lot of road traffic accidents, a lot of different kind of accidents all across our country, and then we are not managing it rightly. What is first the emergency care for such accidents, and then later on how do we proceed to the hospital? How important is the time factor in it?
Well, I say time is the brain. And whenever there is an accident and the patient get injured, majority of those having head injuries, because in our country we are not following the proper guidelines. We are not wearing the helmets, we are not following the speed limits, and in those accidents majority of the patient get head injuries. And if a person become unconscious, then it's very easy to get his airway being compromised by the blood secretions or vomiting due to the increased intracranial pressure, or any spinal injury which can be aggravated by manipulating the patient while transferring from the accident site to the the ambulances.
Right.
For that we have to start from the very basics. We have to train our the 112 staff to how to take care of that unconscious patient. If a patient is unconscious, we definitely have to take care of the spine, especially the cervical spine. If there is a minor dislocation or minor injury and we don't know how to shift the patient from to the ambulance, we can aggravate that injury and can make the patient paralyzed for whole of his or her life. For that we have to train that very basic stuff. In case of head injuries, first of all we have to take care of the spine, especially the cervical spine. For that we have, if you are working in a field, then you can put 2 sandbags along the cervical spine and you can tie a rope over it, and it will immobilize the patient, immobilize the spine for a couple of till the patient is being shifted to some specific area. And for if you have a cervical collar, that is very good, and first of all you have to that apply on around the neck, and it will protect the spine. And if you see a patient who is having a head injury and he is vomiting, then you can turn the patient on a side so that the things don't go into the
They don't aspirate.
yeah, exactly, they don't get aspirate and they don't get choked and have the external other injuries apart from the head injuries.
But when you have to mobilize a patient from the site of accident to the other, then you're saying that they should use some plank under them, or they can just lift they should never ever lift their...
Well, there is a spinal board in every ambulance nowadays, so if you have the spinal board, it's better to put the patient on the spinal board and then get it mobilized to the other specialties. If you don't have that spinal board, then there is a process that 4 people can take care of that unconscious patient, and that patient can be shifted to any stretcher in the form
without
of log
lifting
roll.
the,
Yes.
Without lifting the hands and the
yes,
feet.
exactly.
Right.
And then can be shifted
Okay,
to...
so why is it that people over here delay going to the hospital? They just bring them home, they keep doing different things, and the more and more they delay, is the damage going to be permanent? And how would you advise patients to just rush to a good tertiary care hospital and get evaluated by a neurosurgeon as soon as possible?
Again, I will say that people here, they don't they don't understand, or whatever their beliefs are, they actually they more believe on the common people as compared to the doctors. Whenever they have an accident and the doctor tell them that there is some kind of head injury and they need admission in the hospital, they usually they say, no, we will take our patient home and we have a Baba there and he will get it corrected. So in that case, again, education matters, and if a patients have that kind of injury, we must tell the patient attendants that this is the injury, and if they don't treat it seriously, then the patient get, of course,
Disabled
permanent
for life.
disability for that.
Okay,
due to
when
that
you
injury.
talk about an injury to the brain, one is paralysis.
Yes.
Can you speak about the effects it has on, for example, the bladder, on bladder control, on your sexual activity, on everything else that is related to nerves, not just the, not just movement?
Unfortunately, I have seen a lot of young patients getting involved in the road traffic accident and then getting paralyzed due to the cervical injuries. In that condition, they cannot move their limbs, they cannot control their sphincters, and they don't have that sexual activity. So in case of that kind of injury, early intervention is very much necessary to avoid to bring back those functions. So if a patient get a cervical injury, then you must see a neurosurgeon and get operated as soon as possible, because doing early surgery can save the nerve roots and spine.
What is the post-op care involved in a patient who has undergone a neurosurgery, for example, a brain surgery after an accident or a spine surgery? How long do they have to stay in the hospital? How long do they stay immobilized? And when do they start or resume their activities?
It's all dependent upon the severity of the injury. If an injury is mild, the patient can go home on very next day. However, the injury is severe and he get operated either in the brain or the spine. He have to stay in the hospital for a couple of days, even weeks, and after that rehabilitation is very important, because without giving rehabilitation to the patient, the surgery is 50% beneficial. The 50% benefit comes from the rehabilitation, which is being done by the physiotherapist or professionals, or even they can do it at their home if they hire some professional person.
Okay, Dr. Saab, how do you make a plan when somebody comes to you? They tell you we have so and so pain, or we had so and so accident, and you operated them. What kind of plan do you devise for them after the surgery as well? Before for example, a lot of doctors advise that 3 months physiotherapy, then surgery, then 3 months.
Well, my
again.
routine is that before doing surgery, I make the patient understand that they are suffering from this condition. I'm going to do this. However, after the surgery, they will have to have this physiotherapy for a long period of time, because without rehabilitation, you are not getting better. And for that, you have to hire a person, or you have to go to some facility to get the special maneuvers or physiotherapy done. For me, at least 2 months of physiotherapy after a major spinal surgery or a brain surgery is must. Because in that, if you don't go for this kind of physiotherapy after the surgery, the muscle gets stiff and you feel more pain as compared to the surgery. So I advise.
So how important is keeping yourself warm important? Because they say, right, cold aggravates a lot of things.
Yeah.
So should you keep your muscles and your back and everything warm? Should you be wearing warm clothes or applying hot compress? Because in the West, people keep applying ice for some reason, which doesn't give me relief.
In case of trauma, ice is applied because it decreases the blood supply, it decreases inflammation. Inflammation to some extent is good.
It is good, right?
Yeah, but,
so
but when
I saw this shift when I went to the West. I saw people over
the
here
people
always apply warm things, and
Yes.
over there people apply ice to everything,
Yeah.
which was very scary for me. So what do you suggest?
For accident and emergencies, or for that kind of things, especially when there is muscle ligamental injuries, the ice application, especially after trauma, is good. However, if you just keep applying the ice, that's not good. You have to warm the areas. After that, for that warming, you need to have physiotherapy, stretching of
Infrared
muscles.
light. What do you think of infrared light and those sand?
There are different kind of
hot water bottles.
Exactly, they provide the area. They just causes some sort of inflammation. They keep the area warm, and the warmness increases the blood supply. So when there is increased blood supply in the injured area, you get nutrients, and the recovery process starts.
There are a lot of things in the market nowadays as oils. They say they are nerve tonics and oils and everything. So does this topical application of these oils and of some they say it is of some animal and something
if you put oil on the body and you don't massage it, then it's ineffective. The basic
the thing is the massage, not the oil.
Yeah, not the oil. Because when you do massage, it increases the blood supply again. The blood supply increases increased recovery.
So it is the massage that is good, not the oil.
Exactly.
What about these nerve tonics in the market? They're saying, you drink this tonic or drink this, I don't know, some formulation, and it is very good for the nerves. Are there things that are actually so good for the nerves?
Again, they have
some
more
herbs.
placebo effects as compared to the
Are there any herbs that you would advise to people that they are very good for the nerves?
For me, when I was a kid, my mom and dad used to say that please eat the almonds and the walnuts. They increase it. But looking at the shape, of course, in nature there are things which help you have good mental health and physical health.
So we spoke about road traffic accidents, but there are a lot of children playing outside and they fall off swings and they fall from, they're hitting each other and they fall and they have a head injury. After that, the child falls asleep or feels drowsy and the mother never checks it. And then later on, after a few days, they start showing some kind of symptoms. So what is this hematoma, or I don't know if it's collection of blood?
Kids have, they have more capacity to sustain an injury as compared to the adult one, because they have lax sutures. When there is injury inside the brain, they can have more space as compared to the adults. So if a kid fell down or become drowsy after the injury or have episodes of vomiting, it's better to take the kid to the hospital and get a CT scan done. Because in these conditions, if the hematoma is there and it start increasing in size, at times comes when the brain compensation fails and the patient suddenly deteriorates. So don't take it lightly, and if the kids fell down even from the bed, serious head injury can occur.
When we talk about kyphosis, scoliosis, curved spine, what are the reasons for these, curvatures, abnormal curvatures, and can they be aligned surgically? How long does it take? And do they, like for example, when you align some joint, you have to put a plaster. So do you have to put a plaster on the spine?
Well, if we talk about the scoliosis, there are two different kinds of scoliosis. One is the congenital, which is someone is born with that thing. And the other one is the degenerative scoliosis. It comes when you are normal, born with the normal spine, but later on you don't take care of your spine.
Weights you've
due to
lifted.
due to some injury, you have that curved spine.
Right.
So in case of kids, if they have scoliotic or kyphotic spine, first of all we have to check the angles. There is a very famous angle, Cobb's angle. Maybe you have heard about it. We always look at it. If it's in some kind of normal range, we can take care of the kid by just observing him or giving him some jacket therapies, which will, along with physiotherapy as well. So if you look at the causes of these scoliosis spines in congenital problems, they are majority of having problem in their genes. Either their muscles are weak, or there are some kind of bone diseases, or especially some problem in the spine. When the spine is adherent to the lower vertebrae and it's not coming up, it causes the curved spines in kids. So for the kids, we have to follow up the kids properly. We have to give the physical therapy in the form of different jackets, customized jackets, which will lead to the decrease in the scoliotic and kyphotic.
So they keep wearing it day and night, that jacket, or night they remove it?
At
It's
times
more
they
like
have
braces.
to keep it 24 hours. And at times, of course, if the curve is not in a certain limits, they can remove it at night.
How important is the shoe, the mattress, the seat that we use in maintaining a good posture and ensuring that the spine is fine, especially people like, for example, drivers who do very long work, or people on the computer and everything. So what kind of mattress, what kind of shoe, what kind of
well, if
seat
I
would you
say
advise
that
them?
majority of the patient who has having back pain or the neck pain, they are the office workers, they are the drivers, they are those people which are sitting for prolonged period of times. So it means that sitting, of course, is very important, and it's get a big role to get a disease or not. So for those persons who are having prolonged period of sitting, for them I will advise that they have to keep their spine straight. They can keep it by sitting straight. Even they can help it by putting a back pillow, which will make their spine straight. And apart from that, if you have to sit for quite longer time, then you have to stand up and do some stretching every hour for 5 minutes. That's good for to protect the spine for getting any disease.
When we talk about neurological diseases, I understand you're a neurosurgeon, but what role does people have a lot of MS or multiple sclerosis? Why are they having it so much nowadays, and how do you prevent that? That is also a nerve disease.
Yeah, exactly. It's a nerve brain disease, multiple
Right.
sclerosis. And again, I will say that talking about the multiple sclerosis, it can either happen by a chance, or it can have in the genes. Multiple sclerosis is a problem in which, again, the covering of the brain and the spine and the spatial structure, which is protecting the normal function, is get destroyed. So at times it's a reversible condition. Patient have a sudden attack of vision loss or any limb or function loss, but it get better. There are different types of multiple sclerosis in which the patient can have these things permanent as well.
So are there any surgical options for multiple sclerosis? No.
No, of course, unfortunately, there is no surgical option for them. Yeah, demyelinating
so
disease.
it's only medically. Can you preserve it or no?
Yeah, of course, you have to have some medications which have protective role in the multiple sclerosis, but they don't have any cure.
Okay. The recent advancements are showing that conditions like Parkinson's and Alzheimer's, where they have some neurofibrillary triangles in the head or some kind of increased activity. So do you surgically cure that as well?
For initially, when there was Parkinson's disease came, the initial solution was surgical. Later on, there is a drug which is called methyl dopa, which taken over that surgical procedures, and the people start using it, dopas drugs, which improve the symptoms of tremor and moving around. But nowadays there is another newer one that is called deep brain stimulation, in which we localize the specific area where there is a problem which is causing this Parkinson disease. So we have to put the stimulators in there, and we have
It
a
helps.
rechargeable battery which
Nice.
causes a
And
small
how
cons-
early on can this be done? Like for example, when can it be done if
if it's
somebody
not
is
responding
diagnosed?
to the medication, and if the patient is not able to take medication all the time, or there are side effects of medication which are very disabling for the patient, then it's better to go for the deep brain
So, and
stimulation.
Alzheimer's also, can it be helped or not?
Alzheimer is not
No.
helpful
No.
with the help of other things like
What
smoking.
about epilepsy? Epilepsy is
Yeah.
also increased activity in the brain. So is
Exactly.
there any sort of surgery that will help children? Because you know these
For epilepsy,
anti-epileptic
yes,
drugs.
we call it a functional neurosurgery. It's a separate field of neurosurgery which deals with this kind of problems, especially the epilepsy. For epilepsy, we have again the deep brain stimulation, the vagus nerve stimulations, and apart from this, there are multiple surgical procedures where we can, cure this epilepsy.
Okay, so it is better for them not to go for these drugs and instead get it operated. Would you say that?
It all depends upon the type of
diagnosis.
epilepsy, and if there is single focus, then it's better go for surgery and get it removed.
And what about trigeminal neuralgia? Is that also a condition that is related to you?
Yeah, of course. Unfortunately, trigeminal neuralgia is a disease, sorry, in which majority of the patient presents to us when they have all teeth taken out by the dentist, because the pain initially they think that the pain is coming from the tooth, and they taken out all the tooth, but yet there is a pain. So actually, they think that this is not the tooth pain; that's the trigeminal neuralgia. So majority of the patient who comes to us, the dentist refer to us after extracting all the teeth. And then, of course, trigeminal neuralgia is a very disabling condition. Even the touch of some light
even
thing
the breeze can.
Yeah, exactly. Aggravate so much
So what
pain
is the
that
cure for that?
people can have suicide due to that pain. If talk about the pain, the one drug which is very famous, and majority of the patients, 70% get relieved with the medication, is again Tegral, carbamazepine, which is very effective for this kind of disease. However, if the patient is not getting relief with this medication, we have other options as well.
What is a nerve block? A nerve block is an option for a lot of people with different kind of pains. Do nerve blocks help? How long do they last?
Well, nerve block is a very quick procedure to get the pain off from any sort of area. So in case of trigeminal neuralgia, as in case of sciatica, injection is being made with a local anesthesia, which causes which blocks the conduction of the pain down the limb, so the patient get relieved quickly.
For how long does it last?
But it's very temporary. The patient can have even on the very next day can have the same symptoms of the pain, and 3 to 6 months usually.
So Dr. Saab, a lot of people in the market nowadays, aestheticians, right? They are taking away the role of neurologists, and they are applying Botox for for migraines and for spasticity, which is very wrong. Ethically, they should not be. They should be limiting their use of Botox to wrinkles and everything, but they should not be allowed to put Botox for migraine and for spasticity. So what do you have to say about this malpractice? Number one, a lot of dermatologists and so many people are claiming
nowadays everyone is
doing aesthetics for some weird reason. Yes. And can you talk about migraine and the role of Botox, and how a neurologist is the good person to actually assess somebody for it and then apply that, knowing where the spasm is and where relaxation is required?
Basically, if we talk about the migraine, it's a very separate entity, especially in the West. There are people who have specializing in the migraine aesthetics. But here, everyone is specialist.
Everything is specialist in everything.
Everyone worldwide is specialist in treating migraine. And if we talk about the Botox injection in case of migraine aesthetics, of course we can give. Botox is a toxin. It's basically causes the muscle, neurotoxin. It causes muscle and nerve paralysis, and causes temporary relief for a couple of months, 1 year. But it should be injected by a qualified person, because it's a neurotoxin. Injecting wrong amount of medication in a wrong place can be very lethal.
It can, and people are misusing it a lot.
Exactly.
What are the different reasons of this spasticity? Some people have conditions which put their entire body in complete spasm, right? So I don't know the names of those conditions. Like, what are those conditions? Number one, for example, I just know about tetanus, but I know there are some other conditions where it goes into complete spasm torticollis or something
Yeah,
like that.
torticollis.
So what exactly is that?
Spastic disorders, it is another separate chapter in neurosurgery. Spastic disorders can be due to cerebral palsy. If you talk about the kids when they get born and they have birth asphyxia, they don't get the oxygen while having in the specific time period. So the specific part of the brain get damaged, and that part which is controlling some part of the body, that area is getting stiffened. So spastic disorders are majority of the patients having some kind of insult during the birth. So in that case, the patients present to us with hemiplegia or quadriplegia, in which all the half of the body or all four limbs they are in a spastic condition. Apart from that, birth asphyxia or cerebral palsy kids, if a person have a stroke, which is very common, part of the body is being damaged due to the blockage of the blood vessels or its brain hemorrhage, that gets stiffened due to the overactivity of the other neuronal circuits which are being under control by the brain. So in that case, we have to have good physiotherapy. Again, I'll say in case of stroke patients, if they don't care of that patient early, then the muscle becomes stiff and causes a lot of pain. Apart from that, there are certain other conditions which can lead to spasticity, specifically in the cervical spine. When the canal through which the spinal cord is passing, it gets stenosed, and that can lead to the spasticity either in the single limb or in all the four limbs. For that kind of spasticity, we do surgeries and patient get better, alhamdulillah. A few days back, I operated upon a lady who was around 65 years age. She was immobilized for the last 6 months. In the cervical spine, there was canal stenosis. And I did surgery, alhamdulillah. She yesterday came, she was moving around, and
so
I was
that's
very happy to
nice
see her.
and heartening to see that you're
exactly.
making people move again.
Alhamdulillah, I'm very satisfied. Yes.
What is Guillain-Barré syndrome? How does that present? Ascending paralysis, is that a neurological involvement as well?
Well, neurosurgery and neurological disorders is another universe.
It is.
A lot of things.
I think today I'm specializing in
no, GBS is a problem in which a person gets like he's having cough, he gets diarrhea for a couple of weeks. After that, the body again, body have a safety mechanism. Anything which get into the body, it activates immune system. And if the immune system get activated by that thing resembles the body own tissue, then the body own tissue is being destroyed by that army. So you get the Guillain-Barré syndrome. In that, this is called ascending paralysis, which the majority of patients, they start weakness in their one leg or the other leg, and then that start ascending up. And it can involve your hands, and it can involve your respiratory muscles. And people at times go to the ventilator for a couple of months.
So the earlier diagnosis, the better?
Exactly.
And it can be managed on time?
Yeah, exactly.
What is the test for Guillain-Barré?
Well, Guillain-Barré syndrome is a specific history. A patient gives a history of chest or UTI or GI tract infection. And then he says that he developed infection, weakness in the limbs, and then it is coming up. So that's a very specific history for the GBS. However, if you do a test, which already we have talked about, the NCS EMG, it gives clues about that the person is suffering from that disease.
And what about facial nerve palsy? A lot of people start complaining all of a
lakwa.
sudden, and they start having pigeon blood and things like that.
Well, the facial nerve is a nerve which comes and supplies your face. A face has a lot of muscles of different facial expression, So when that nerve, it passes right behind the ear. So if there is some kind of infection in the ear, it causes, the nerve to stop carrying its conduction. That will lead to the weakness of those muscles. So the patient have the droop face and he cannot open up eyes. So the patient have symptoms of that facial weakness or lakwa. So majority of the patients who have this kind of condition is temporary. Within 3 months time, 3 to 6 months time, they recover not to 100%, but at least 80-90%. But for that, we have to give the medication, we have to treat the ear infection, and we have to give them the facial EMG and NCS therapy.
Thank you so much, Dr. Asad, for giving us a deep insight about pain, about how to manage your brain and spine. Any one message before we leave? Thank you so much for joining us today.
Thank you very much for you as well. And the last message is that in case of any back pain, any headache, you must see your doctor, and a qualified one, and a neurosurgeon, because nowadays the social media is so common. the people can get into the wrong direction by looking at those social media videos and all those things. They are at times very misleading. But whenever you feel chronic back or leg pain or headache, you must see a neurosurgeon. Thank you very much.
Thank you so much. Thank you.
you.